Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast. We're going to speak to you about the kidney stone, the problem of the kidney stone which causes you unbearable pain. So what is a kidney stone? Why do we get pain? So if there is a formation of sediments in the kidney, we will talk about it a little later. There's a stone in your kidney. There are two kidneys in every human body. And there is a tube called ureter, which is about 14 centimeter connecting your kidney and the urine bladder. So there's one ureter from the left kidney, one ureter from the right kidney. And this ureter tube is a very sensitive one. It can only transport liquid. It cannot transport any solid. When there is a stone formation in your kidney, more so basically it happens with uric acid. Uric acid in most part of the body gets crystallized. If they get crystallized in your joints, bone joints, they become very painful. That's called gout. When the uric acid gets crystallized in your kidney, it's one of the major reasons for the kidney stone to form. And they become a solid component, which becomes the kidney stone. As long as the kidney stone is formed in the kidney and it's going to stay inside the kidney, you will not know anything. Remember this. Kidney stone is not a problem. Kidney stone is not a disease. Kidney stone is a small functional problem. It's not a disease by any means. Don't get scared. When the kidney stone is there inside the kidney, which will not cause any pain to you, you will also not know. After some time, the kidney realizes there's somebody who's sitting here. I don't want him. He's, occupying my cell space. So he'll start pushing it. When it comes to the mouth of the ureter, as I told you, it is very sensitive. It can only transport liquid. The moment a solid component touches the ureter, the pain starts. The pain is very abnormal. The pain is very intensive. The pain which you have never experienced before if you're going to be a stone touching your ureter. So if the pain goes beyond certain level, you start sweating. And further goes, you start puking because the vomiting mechanism triggers. The body knows that something is happening. So the sweating and vomiting also starts. Don't get scared. These are mechanism, false alarm. But the pain is going to be enormous. When the kidney stone, starts moving into your ureter, all the 14 centimeter, the pain is going to be there. That's all. When it, passes through the ureter and falls into your urine bladder, it gets dissolved there because the urine collection is there. Then there is no pain. Once it crosses the ureter, then there is no pain at all. This is what your entire kidney stone is all about. So you don't need to get scared. It's not a disease by any means. But it is a problem which is going to give you enormous pain, unbearable pain. Those who are very sensitive to pain, they start rolling on the floor. So you have certain anti-inflammatory painkillers. There is no harm in taking them at the time of the stone touching the mouth of the ureter and start traveling. So, control your pain with some painkillers. Wait for the stone to roll it out, into the urine bladder, then your problem is solved. Suppose if the stone is bigger and it gets stuck in the ureter, don't worry, there's a small procedure available in our modern science. It's very good. You have the uroscope, it's a procedure. It's not a surgery. They, send the ureter through your urinary hole and go to the ureter, suck the stones and bring it. There are many, laser bombardments are also there. They break the stone into crystals so that it can pass very easily through the ureter into your urine bladder. So once you get into, kidney stone problems, in many cases, it keeps coming back again and again, once in 3 months or once in 6 months or once in a year. What you have to do is you have to quickly understand that, uric acid production is higher in your body because of too much of sugary products. All sugary products, when we are excessively taking that 50% of all your sugar components are fructose, which gets converted to uric acid. There are too much of fructose in your corn-based food. There are too much of fructose in all your fruits, jaggery-related products and sugar-related products, sweets, desserts and frozen desserts and ice creams and milkshake and so on. Try to reduce them as much as possible. Try to remain within 25 to 30 grams of sugar and sugar-related product in a day. Make sure the fructose from it gets metabolized by the liver so you don't have excess fructose in your body to, produce this uric acid, and uric acid is also very high in animal products like all kinds of meat and eggs and so on. So try to reduce them also, and stay away from your kidney stone. Kidney stone is not a disease. Don't get scared. Just control yourself with some painkillers when you get the pain. That's all. Thank you very much. Good luck. And thank you very much for your attention. I'll see you again. Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.